I'm going to talk today about the Netflix documentary, I believe it's called Root Cause. I will confess, I had to turn it off after a little while. What I love about something like that is that it has generated topics of interest. And I think that's really important because, you know what? I want my patients to ask me questions. I want people to question the status quo, because in the end, that helps us inform you and give you the best possible treatment. To me, a patient that understands the why something's being done and how is always going to be better off than somebody, who just doesn't question anything. There are nothing short of the millions of root canal treatments that are done in this country. And I'd like to define what a root canal treatment is, because I think that there is some misconceptions. Every tooth has an inner part. Think of it as a canal just running through the tooth. And normally in a healthy tooth, that has the blood supply and the nerve that's in there. In reality, the tooth is technically a living organ. However, the parts of the tooth that we see are already developed, and it is not continuing to, the nerve really plays no major role once a tooth is developed. It is just there as a remnant of its development. And so what happens is when the cavity gets big enough or a crack gets big enough, it gets into where in the guts or the inside of the tooth, the bacteria gets in there, and then that can lead to pain and inflammation, and eventually lead to infection, and can lead to loss of the tooth. And when the infection drains to the bone, that infection, if left there, is going to go into your body. And that is the reason that root canal treatment exists. Because the alternative to a root canal treatment, if you don't do the root canal treatment, the only alternative is to take the tooth out. And so we look at root canal treatment in a positive light, in a way that this is actually a way for us to save your tooth. Otherwise, you're taking the tooth out. And so, to me, part of the problem with the root cause and then the documentary is it advocated taking out a link that really hasn't been scientifically proven. And as a dentist, as a man of science, my training and everything I've been taught has been through the scientific mediums. We practice what we call evidence-based dentistry or evidence-based medicine. And evidence-based medicine requires studies and techniques of presenting research and studies so that the data that we collect is accurate. And that is what we base what we do on. And that does not mean I am not open to my patients' different belief systems, my patients' different desires for how they want to be treated. And I think it's very important that comes across, because ultimately I believe in something called autonomy, and autonomy is the patient's right to choose their treatment. And we will 100% respect that. But what I'm not going to do is I'm not going to tell people that this is something that can cause all these ailments when really there has not been any scientific data for me to base that upon. Does it mean it happens or not? I don't think anybody really knows the answer to that. I'm not going to disprove something that I haven't done the research on, but according to our scientific current data, there has been no links with any adverse ailments or effects of root canal treatment. In fact, there have been people that have died because they didn't get a root canal treatment done. We've all heard of the 5-year-old boy that died not long ago because he had an abscess. To me, the part of the problem with Netflix, doing something like this, is that it created a little bit of havoc, but I think it's been since addressed, and I think there's been some calls from the American Dental Association and the American Academy of Endodontists to actually have that removed. And I'm not sure if it has been or not, and it may well have been removed, because I think there was quite a big public outcry afterwards. So root canal treatment is, in my office, is safe. It is done to the highest possible standard, and really it is a way to save your tooth. And contrary to popular belief, it doesn't always have to be uncomfortable. I know that's one of the biggest things my patients kind of are apprehensive about when they do need something like that. So we do everything to make sure you're comfortable. We are following the latest guidelines, we're using the best equipment, and the replacement of a tooth that is missing is an implant, and that's what they've been advocating. However, to me, there is no better implant than your own tooth, and if we can keep your tooth there for as long as you live, that is always going to be the best option for you. So I hope that's helpful. I know it's kind of long, but I just wanted to explain that, so thank you.